it takes a lot of courage to go and ask your provider, hey, I need my needs met. This is what's going on. Like, what? Please help me, and not be scared that the provider is going to be like, so,
Well, let's schedule another appointment.
I know.
For another time for us to really get into that.
Yeah,
and talk about
absolutely.
That. But I mean, that's also just, as you're saying that, like putting our needs, voicing our needs, and being okay. I guess not knowing what the response is, but still asking the question. If like that's a general.
Absolutely.
Imagine like a life
like a
skill.
lesson, yeah, for sure.
I'm Dr. Emerald.
And I'm Kat Garcia.
And we're Painting Wellness, where we talk about the pieces of health,
relationships, and wellness
that create the art of life. We were talking the other day, though, about the difference. We can start, I think what's coming to my mind right now is like the difference between men and women and how they advocate for themselves.
Yeah.
And I don't know if it's okay. So even when there's people in our lives, so I have a hard time when I'm sick to then going and asking for help.
You have the man flu.
I have the man flu. Well, but it's usually because I'm debilitated by that point, and I can barely
debilitated, like the man flu, or just because we're really debilitated.
Oh, of course, yeah, always, anytime,
yes,
yeah.
Of course,
yes. I spike a fever 100.0, yeah.
Oh,
yeah.
It's like the Rona.
Yeah. Oh, watch out. Yeah, I'm laid up for a good while, and I need all the help at that point.
Yeah. Well, I mean, in the advocacy, we were talking about maybe the idea that men typically, I would say I'm generalizing, but typically don't like to go to the doctors or are not as good as going to get help, but they are probably the worst patients. You're not going to own the worst patient part.
I don't know if I can own that one. Because I can also see, I've seen a lot generalizing. I've seen working professional women that don't come in for their appointments, or
what are you looking at me? I do really well getting adjusted. I make all my appointments. No, you're right. I think it also, I think it's a generalization. You're right.
Yeah, because I think at times what I see for women is that they don't feel like they can take care of themselves. Like they want to, as long as there's nothing else going on that they then have to take care of.
Yeah, putting other people first.
Yeah.
Like their husbands.
That's important.
Yeah.
Because I can't help myself. So, but I mean, I guess it goes back to that. I like to say putting the oxygen mask on first, because
you oxygenate.
You got to oxygenate. Yeah, that's an important piece of this whole thing. But I don't know. I guess men, because I can say for myself, I have a hard time getting in, even to the chiropractor. I would say
that's a damn shame.
I am a chiropractor, and so not going to the chiropractor is...
Well, but and it's priority, right? What's your priority? But, when we do put other people first, and a lot of moms do and a lot of dads do, and a lot of health providers do as well. I see a lot of nurses and a lot of teachers and helping professionals. Everybody's first before them, right? And so they don't find time to get help for themselves, and they don't help themselves advocate for better health for themselves either.
When you say that they don't find time to advocate for themselves, is it asking follow-up questions, or if it's just a basic, if they get something or they're told something maybe that it isn't jiving well for them, or what they're kind of intuitively being themselves?
Yeah, I know I sent you a TikTok the other day about a young lady sharing her story about going to the doctor and feeling really uncomfortable, and how she went in for an earache and had questions, and then she left and she was devastated.
Yeah.
And that happens a lot. I think we are getting better, but I think going to the doctor and not saying all the things that we want, because maybe the provider's dismissive, but maybe we don't think they have time, so we don't even ask, right?
Yeah.
And then it's oh, okay, well, my ear hurts, and my eye hurts, and my finger hurts, but I don't want to bother them, so I'm only going to talk about my ear that hurts and not my eye and my finger, and then what happens, and then we don't make time to go back for the other things.
Yeah,
because
it's the priority.
It's the priority.
Yeah. I think that's a big piece too, and it's also, I'll speak for myself. It's only a problem once it starts to really affect the things that I really want to do or love. And until then, it's I can just manage.
Yeah.
So those other laundry list things are I could probably get through it.
Yeah.
but over time, I mean, that builds until it is the priority, I guess.
Absolutely. Yeah. And I think, one of the things that you and I talk about a lot is how do we make sure that people not only make time to whatever their gender, make time to go to the doctor, but also ensure that they're telling the doctor, like, this is what's happening, and this is what's happening, and this is what's happening, and make sure that they use the resources and advocate for themselves so they can actually get the help they need.
Yeah.
Time and time again, I see people with chronic illnesses that don't get answers. And, I say, okay, but what's the treatment plan? Like, no, I don't know. They don't tell me. Or I'm like, did you ask? Well, no. Like, and it's that fear of, we don't want the doctors to be mean to us. And as providers, we have to be very careful about that too, is making sure that we allow the space for people to advocate for themselves and to ask questions, right? Not be so hyper-focused that we just shut down anything else that they might be want to talk about, or so. But creating the time and advocating for ourselves are, definitely two different things too.
Yeah.
So the first thing to do to advocate for ourselves is actually creating the time to actually go to the doctor or the chiropractor.
Well, what's great is I am a doctor, so
You don't make time to go to the chiropractor, no.
But
yeah.
Well, I wonder, like in that, I'm thinking, like even practicing, I guess, what you might say to the doctor, or making a list.
A list is
or something,
great.
Because I've certainly, when I've gone in for anything, shoot the store, if I don't, like, I'm going to forget what the main things are, or whatever it might be, and so when there's maybe less stress, because I can say when I go into a medical office, my stress levels go up.
Oh, yeah.
And then my thinking goes down. And so if I were to go in maybe with some sort of a pre-planned game plan or something, or a list, that would help me really advocate for myself too.
That's what we call flooding. You get anxious and your cortisol starts pumping, that fight or flight, and then you can't really, the level of information that comes in or out is so low.
Yeah.
So having a list is really great. One of the things that I've experienced myself is that I'll call the doctor and I say, well, my ear hurts and my eye hurts and my finger hurts. And they're like, well, yeah, but we can't see you for all of that because the insurance will only pay for certain codes. And so it's like, okay, so so that part of not only do I need to advocate making time and advocate telling my doctor, but then now I have to make more time and advocate that you have to treat me as a whole person, right? Not just my ear, because, I don't know, maybe my ear hurts and my eye I can't see because my ear hurts. I don't know, right?
Yeah.
Like, I don't know. But I think there's a lot of work to be done as far as advocacy from the patient standpoint and then from the provider standpoint.
Definitely. Because, I mean, from a provider standpoint, I'm sure you, like, for yourself too, it's like, at times, I feel like I have to try to put a container around what's going on, because it could be a real long session, real fast, and then it's so, maybe I get overwhelmed with, like, all the things. And something that I've certainly used and I continue to use is, if there's, like, what are your top 3 things right now?
I do the same thing, yeah.
And then as we're working through and we're steadying that ship, then going in and going to some of those other things that, if they're still there and if they haven't resolved. But, yeah.
I had a provider recently tell me, he's like, yeah, that sounds great, but I really don't have a lot of time. So can you just give me, like, bullet points?
Cliff notes.
And I'm like, well, I thought that's, but I maybe it's like story time for me. Like, I want to tell you everything that's happened, because I think it's important, right? Give you some context. But if you cut me off and you don't let me, I'm like, well, I guess just my finger hurts.
Yeah. Then you shut down.
Exactly. Because it's like,
you're not able to advocate for yourself.
Yeah.
Yeah, that can be really tough, especially if you're, like, going in, you're like, all right, I'm going to, like, do the things.
I'm going to do the things.
and then it's like, no. And you're like, damn.
Especially for those of us that don't want to make time, don't have the time.
Yeah.
We got a lot of parents out there that don't have the time. They might not help with the kids and the scheduling and the work and, getting time off work and all that. And, and the providers cut. It's like,
there.
I got 15 minutes. Hurry up. Right. And so, but I love that idea of the top three things. Tell me what the top 3 things are. I tell my patients that all the time. Tell me the top 3 things. And then, that doesn't mean that we're putting, like, some sort of line in the sand, but it gives us a starting point.
Yeah. Well, it allows you to focus on an area, at least, too, where it's not, like, feeling so overwhelmed of, like, oh, I have to work on my exercise, my diet, my mental health, my emotional health, all these different things. It's like, hey, let's like learn to crawl first, and then we can build on that foundation too, which could be nice. And going back to the piece of people not having time, or finally that's the thing. I think that's the other piece where it's like we only go in maybe once a year, maybe once a year, and then it's like, oh well, now here, here's my laundry type of a deal. Then making time as like a lifestyle choice, be it like therapy or working on your physical, emotional health, whatever it might be, of being consistent. And so instead of only going in at crisis, it's, hey, we're able to be more level.
Yeah. Do you think as a man, it's easier for you or different from your perspective than maybe for me, to put off going to the doctor? Like I might do it like because
as compared to a woman?
Yeah, I don't know. Like, I mean, because we're talking general. Like in general, people just don't make time.
Yeah.
Right. But I know, like, I fuss, and I know a lot of women fuss, just sending their husbands, go do the thing, go do the thing. Not that we go do the thing, but we encourage that. So, like, is that what do you think is the biggest barrier maybe for you as a man to go advocate for yourself to get the health care that you need?
I'm trying to suss out the difference between maybe my own personal stuff that I don't know if it like has to do with necessarily being a man not going, and then being, because like I don't feel like when I've gone to see a doctor that I'm getting the quality of care that I feel I deserve. And so then I'm leaving, or even in the appointment, I'm like, why am I even here? Why am I here? Because at the end of it, I don't feel any closer or having any clarity about what's going on. Or even not, I don't even know if I need clarity. It's just having an outside viewpoint as a guide. That's, I guess, where I like the idea of the guide. But to work with, hey, here are my goals, and then here's the deficits that I'm noticing. How do I close that gap? As opposed to, and maybe it's the time thing of like, well, okay, I'm going to give you the, like, here's my 3-prong approach, and we're going to go and do this. And it's like, well, why? Why is that? Or is this just the generic flow chart? I think that's part of it. And I don't know if that's a man thing. I don't know, because then like now I'm like, oh, I just probably do that. I could have done that myself.
Yeah.
Like, why
well, it's so interesting because I mean, we're saying that ourselves as provider, we do that 3-prong approach, but then you're saying, but if my provider says that, then I'm like, why am I even here? Like, I don't understand. And so, I mean, and that right now is really where we're talking about that disparity, right? Like, so as providers that in the kind of business, you being a chiropractor, me being a therapist, that we require sort of for improvement, for consistency, and people to come over and over and over. And so doing a 3-prong approach may work for us because we have a longer period of time, but then we have like, well, I don't know that I can continue this 3-prong approach and make time for the chiropractor or make time to go to the therapist every week. But when we're saying, no, but as providers, this is what we need to help you. And so as patients, we're saying, oh, no, but that's not going to work for us. And so it's very interesting, I think, that as providers and as patients, we can see that what we're asking of patients doesn't really necessarily work for us as patients.
That's a good point, yeah. I think the time piece especially, like devoting time could be the hardest piece. And it's so like, I always amaze myself with my excuses. I'm like, that's a good one. That's a really
I'm going to write that
one.
down for later.
I'm going to use that again. But yeah, I think that's a good point of like stepping back and figuring out like how can I make this work for myself? If I were my patient, what would need to happen to make myself come in and see me? But yeah. Yeah.
I mean, I think, and that's really where we talk about like, that wellness or the health advocacy part, right? Being able to teach clients to talk to their providers to get their needs met, and to talk to yourself, I guess, to make sure to make the time to do that and to be okay speaking up. And I know that we're going to, spend some time talking about how do you speak up and what's included in advocacy, because that's such a big term, right?
Yeah.
But I think that really making sure that we say, there's got to be ways that we can do better. There's got to be ways that we can be better patients and we can be better providers. And what's that balance, right? Like, because I'm not expecting my PCP to spend an hour with me. That's not possible, but maybe my part in that is I go more frequently.
Yeah.
Right? And then my PCP's part is they listen to me. So if they can't help me, I don't have to come back 4 times. They can send me to another provider.
To where it needs to go. Yeah, and I also, like, I think on that, it would be, I think, if there was something that the PCP or the office was sending the patient prior, that's more than an intake form to really, or at least an intake form that the PCP is able to read before, instead of going in and then reading and then asking you the same questions that you just filled out, is like understanding or some sort of a worksheet or something for the patient to go through to get a deeper understanding of why they're there. Because I don't think it's necessarily, people aren't coming in because of the pain, discomfort, or whatever. It's because they're not able to do what they really want.
It's gotten to that point.
It's gotten to that point that they're like, oh, now this is really affecting things. And for me as a provider, that's always really helpful to know, like, what's the goal? Like, why really are you here? Yes, I know that it's, you say it's because your back hurts or whatever, but like, that's been going on for 5 years. So why now?
Why now?
Why now? What's, it's choose your hard, because the back pain has gotten not as hard, or has gotten too hard to deal with because you're not able to enjoy something else. And now that's really the hard piece.
That's the hard piece, yeah. Yeah, and I think that's, I guess, really the goal, right, is to educate our patients, to educate the people out there. Okay, this is what you can do to tell your provider. This is the nitty gritty. This is the main point. And then, hopefully to educate providers in how do I ask the questions to get to the nitty gritty.
Yeah.
Like, not just vague questions that were taught in school that all of a sudden it's like, oh, okay, so what hurts?
Yeah. What makes it better?
What makes it worse?
Yeah.
Questions like why now is a great question. And I think that, so I think in both parts, both the provider and the patient side, it's really about asking the right questions and providing the right information. And I think that's what advocating for yourself and advocating for your patients is all about, right?
Yeah.
And so really asking those questions, and what are the questions that we need to ask? And there's lots of that, and there's a lot of courage that comes it takes a lot of courage to go and ask your provider, hey, I need my needs met, this is what's going on, like, please help me, and not be scared that the provider is going to be like, so Yeah.
Well, let's schedule another appointment.
I know.
For another time for us to really get into that and talk about
absolutely.
that. But I mean, that's also just, as you're saying that, like, putting our needs, voicing our needs, and being okay, I guess, not knowing what the response is, but still asking the question. If, like, that's a general,
Absolutely.
Imagine like a life, what am I trying to say? Not goal, but
like a lesson,
skill.
Yeah, for sure.
Yeah. So what do you think? I think it's a really good place to like condense, consolidate, or like recap. What do we say? The hunters and the gatherers.
The hunters and the gatherers.
Yeah. So we just had a nice like gathering session of the pieces.
Yep.
And then
so you're gonna hunt.
I'm gonna round up.
We round up.
And we're gonna get the game all there, so then we can hunt these key points. So we have, I think the big one is being able to voice your need, but within that, like, knowing what that need is. And like I really like that piece of, I'm gonna create something for my practice members of, why are you coming in, but then like creating some sort of secondary question of like, but why is that a concern? Because then that can start that conversation. So then when they're coming in, it's not the first time that they're thinking about that necessarily, or really consciously thinking about that. And what else do we have? We have making time for ourselves.
Yeah, we can talk a lot about that self-care.
Yeah. And I mean, providers aren't the best patients either. We could definitely learn a lot about our care, and then how also that dynamic is playing between the patient, practice member, and then the provider. What are some other pieces that?
Gosh, I think those are the biggest ones. But yeah, I think, and there's a lot to talk about.
Consistency.
The consistency and making sure that we're following through with the care, but that comes with the time, right? And making sure, and definitely lots more to talk about how to create that consistency and, do the work that we have to do and all that. So.
Awesome.
Okay.